Hello friend, today I am going to talk about the aortic regurgitation. Definition of aortic regurgitation is: it is a condition characterized by retrograde blood flow into the left ventricle due to an incompetent aortic wall or dilated valve ring. Cause of aortic regurgitation is hemorrhagic fever, ankylosing spondylitis, infective endocarditis, Marfan's syndrome, systemic loop erythematosus, giant cell arteritis, aortic dissection, aortic stenosis, heart valve disease, infection and trauma, high blood pressure, etc. Symptom of aortic regurgitation is shortness of breath with exertion, fatigue, unpleasant awareness of your heart rate, heart or pulsations, chest pain or tiredness with exertion, strong pulse felt in the neck, swelling in legs, abdomen, and the vein in the necks. Treatment for aortic regurgitation is: surgery may need to repair or replace the disease valve, especially if the condition and symptom are severe. Heart valve surgery may be needed even if aortic regurgitation is not severe or when there are no symptoms. Decision to repair or replace a damaged aortic valve depends on your symptom. Medication for aortic regurgitation is angiotensin converting enzyme inhibitors, angiotensin receptor blockers, calcium channel blockers, diuretics, and adrenergic agonists. Thank you for watching. For more medical lecture and tricks, subscribe to our channel and click the bell icons.